I want to thank everybody for joining us today. Maybe this is one of the really good things about Zoom is you didn't have to drive someplace to attend the press conference. Hopefully you're all doing this from the comfort of someplace safe and you're not out on the roads and don't have to be out on the roads as much as possible. I'll start by saying, last week I joined leaders from around the state for a press conference to show people around the state and this region that we're united and working together to fight this pandemic. We were joined by, public health officials who emphasized the importance of doing something about the rising cases in our region, that it's not enough to prepare the hospitals, but we actually need to be preparing our people. We need to be doing what we can to reduce those numbers. And that's exactly what this group has decided to work on. And we've moved over the last week to announce additional restrictions, and I announced mine last week. I want to highlight, what the most significant restrictions are. Indoor dining was suspended. Indoor sports gatherings are limited to a maximum of 10 people total. The maximum capacity for retail establishments was reduced to one person per every 200 feet of retail space, not stockroom space, retail space, and not to exceed a maximum of 150 people. Large retail establishments have until December 23rd to obtain a letter of approval to continue to have more than 150 people in their retail space, and they're going to have to demonstrate what they're going to do to ensure that they can manage this in a safe way. Religious institutions remain capped at 25% capacity indoors, and letters of approval are needed for outdoor services of more than 25 participants. Again, these are all new things that we're, putting into place. There was a time when indoor dining was, prohibited before. As things improve, we will revisit all this. We're not saying we're going back to zero before anything changes, but we're certainly not going to reopen things under the current conditions. This was an extremely difficult for me and the council, and I don't want anybody to think we took this lightly. We're well aware that we're making decisions that impact lives, jobs, and businesses, but it's our responsibility to do everything we can to keep people safe. I especially want to note, as I've done before, that businesses are not the enemy here. This is not a war against business. This is something we have to do in order to keep people safe. The truth is, the federal government needs to look at what's happened to the business community as the kind of damage that you would experience if you were, fighting a war, or if you were dealing with having to clear an area because of a flood in order to make sure that it's safe. They're not contributing to this problem willfully. They are victims of COVID like everybody else is. And we need the federal government to step up and figure out how to make people as whole as possible so that the trauma of business closures is not what is driving all of this frustration. Whether you're a worker in a business, and if your business closes, you don't know when you're going to come back, and now you're wondering how you're going to pay your bills, or if you're the business owner and you've got rent due and loans on the property and equipment that you have, they need to get relief. It's that simple. They did not do anything. They are not the causes of COVID-19. They didn't do anything to spur it or create it. They are just victims of circumstance. And we need the federal government to step up and fix this. And this ought to be a priority over some of the other things that the government might want to waste money on. This would actually be a proper use of money, and it's something that would help this country recover. If businesses are not able to reopen, and if the debts mount to the point that they're not going to be able to dig out from under it once they do reopen, they are going to have a very difficult time making a decision to make that decision to reopen. If you think you can't stay open, there are people who've already said, I might as well stay closed if that's what I'm going to be facing. So again, I am imploring the federal government to step up with sufficient aid to make sure that businesses will have the opportunity to reopen, and so that individuals can be on unemployment during this period and not wonder how they're going to get their bills paid. We are relying on data and science to make our decisions, as we always have. And in this case, it's very clear we have made a decision, or set of decisions that are designed to slow down the spread of the virus. Unfortunately, Montgomery County is very close to a significant and painful milestone. As of this morning, we have 995 deaths in the county, so we are fully expecting that this week we're likely to cross the 1,000 death mark. That's not a great victory milestone. It's a real sad statement of what this virus has cost people in terms of lives in the county. And it doesn't even count the people who are sick and will have lingering side effects, perhaps for years to come as a result of having been infected. So this is a tough time for us. It's more than a number. It represents, the people we know. We've been touched at the county by this personally this last week. It's our neighbors, our family, and our friends, and the relatives of our friends. It's taken a high toll, and I just want everybody to, be aware of this. And it's sobering, and people should be really sober about thinking about this. And this, sort of leads to what I want to say about the holiday coming up. We've got two big holidays that many of us are used to celebrating. Don't do it this year. Don't celebrate Christmas with a large family gathering. Do not have a large New Year's Eve party. Every time we bring people together, we know that social gatherings are one of the biggest causes of people, of the coronavirus being able to spread. We really don't want people to do that. We really want people to have the patience to wait out the rest of this year until vaccines come and are widespread, so that next Christmas, everybody can get together and you're not worried about how many people are in the room, and you're not worried about, is somebody going to get COVID? We've got a little ways to travel down this road. But we've been on this journey now for 9 months, and a little bit longer is actually something that will help us not have more fatalities and more sickness in our community. So we need people to please abide by the mask restrictions, abide by maintaining a physical distance, wash your hands, and I'd say also be prepared to wear the mask for a while. We know that getting vaccinated may not automatically mean that a person doesn't get a mild case of COVID, and that mild case of COVID is not capable of being spread. We don't know that yet. Hopefully, as the vaccines roll out and people get an opportunity to do further studies that would have been done typically if we had waited longer to unleash the vaccine. But I think people made the right decision once they were certain that people would be generally safe to put the vaccine out. But there are things we have to learn about its efficacy and what it means going forward. And so I would expect that, just because you get vaccinated won't necessarily mean you shouldn't be wearing a mask. And we're going to continue to encourage people to wear masks until we know more than we do today. When we look at today's case count, we had 438 new cases. Our positivity rate is 6.3%, below our peak, but still more than twice what it was a few months ago. And our cases per 100,000 are 43.7, which is about 8 times higher than they were a few months ago. We're reminded that we have to do everything we can to minimize people's exposure to each other, which means minimizing their exposure to corona. That's why we continue to focus on testing. Our testing volume is very high. Last week, we tested almost 12,000 people. Yesterday, we tested 2,372 people, and today a few of our sites are closed due to the weather, but you can go online to see which sites are open. We're expecting testing volume to remain high over the next few weeks as we get deeper into holiday system. And we are hoping that our partners, the many clinics out there who actually provide the tests and run the tests, are able to continue to build capacity so that the waits for results are not as long as they were right after Thanksgiving. We've had a good partnership with hospitals here in Montgomery County. Dr. Gayles and Dr. Stoddard continue to work with them directly. Yesterday, 77% of our hospital beds were in use. We're monitoring this number closely, and we're looking for every avenue we can use to prevent our hospitals from taking on more of a load than they're designed to handle. This virus is continuing to spread rapidly, and we can't stop the fight or let our guard down. And we're going to have to do everything we can do to protect ourselves. So, you can kind of see the light at the end of the tunnel. Vaccines, began being delivered all over the country this week. Unfortunately, because of presidential inaction, 100 million doses that could have been available in this country are someplace else. And we hope that we don't make any more mistakes in dealing with vaccine companies and make sure that we don't walk away from supply when people tell us they have supply they'd like us to commit to. We've got a lot of people in this country, and we're going to need 2 doses right now, at least with these vaccines. So we need maximum production, and we need the government to procure as many vaccines as possible. We've watched our healthcare workers getting shots, and it gives us hope. And among the category of people who were probably the highest risk, it's the healthcare workers. And they're the people you can't say don't come to work, because if our healthcare workers aren't there, then our ability to protect everybody else is going to be severely limited. So I just want to salute the healthcare workers in Montgomery County and throughout the region and throughout the country who've continued to be asked to put their lives on the line in order to protect lives in the community. And I think we owe them a debt of gratitude. And I certainly appreciate everything they're doing to help make sure that that we beat this thing. I know we're all tired. I'm tired. But COVID apparently is not tired. And so until it's tired and until it's worn out, we're going to keep doing what we have to do to make us safe. And as I've said before repeatedly, it's only our actions that can make a difference. The vaccine will help, but it'll be a while before the vaccine becomes widespread. And if you're thinking you're going to get the vaccine next week, keep reading the newspaper stories, because it's very clear that there are going to be priorities set for when the vaccines are made available. And it will not be right away for everybody. They are going to be phased in. And as they become available, more and more residents will get vaccinated, but it's going to take a while. So please take care of yourselves, enjoy your holidays, but please enjoy them safely. And please give up the family gatherings. Hopefully we're getting to the end of asking people to do things like that, but it's not worth the extra cases and the extra pain. And frankly, I've had to do it myself with my family, and I hope that everybody can do this. So again, thank you very much for being here, and I'm going to turn it over to Dr. Gayles.
Good afternoon, everyone, and happy Wednesday. Always a pleasure to be with you all. I actually don't have a ton of updates this morning, and we'll save room for questions. I'll just mention briefly, our numbers do remain at elevated levels, as the county executive mentioned, and those numbers continue to be elevated across the state and across the region. We have made, continue to make strides in terms of increasing our testing capacity. And as it relates to the million-dollar question that everyone probably will have questions about, is vaccine distribution. We continue to work with the state around what that will look like. As of today, we do not know when we will get vaccine to the local health department to be able to administer. Rest assured, we have a plan in place to disseminate those vaccines as quickly as we can once we receive confirmation when we will receive the vaccine, as well as what that supply will be. There's speculation that given the Moderna vaccine moving through the approval process, most likely tomorrow during their hearing and later on into the weekend, that we could have vaccine available as early as sometime next week before the Christmas holiday. Now, with that said, there's lots of people who've asked questions about who will get it and what will the county's dissemination process look like. Well, let's make it very clear. We will follow the guidelines as laid out by the federal level in terms of how those priority groups are defined, and they have been defined for quite some time now, as well as further guidance from the state in terms of how we prioritize within those particular subgroups, such as healthcare workers, first line responders, and ultimately, as we move through to phase 1B, individuals with significant medical histories and conditions. So as we continue to work with the state and get guidance on that, that will help shape our dissemination process in terms of how we will roll that out. But everything we do, in particular in the early stages, will be consistent with the guidelines provided at the state level in an effort to create uniform, standardized approaches and guidelines for all of the different jurisdictions across the state of Maryland. Now, we have, as the county executive mentioned, the Pfizer vaccine has been distributed, a very limited supply of it has been distributed across the country, and half of the Maryland doses were sent to hospitals. And from my understanding, even within that number, there were about 20 to 24 hospitals that did not actually receive doses in the first tranche. From my understanding, all of the hospitals in Montgomery County are either actually getting it today. I had a conversation with some of the hospitals this morning, or we'll be getting it on tomorrow, and we'll start their clinic processes to get that out to their workers and staff members. Similarly, the other half of the initial tranche were sent to pharmacies that are working with the nursing home, the long-term care facility, and pharmacy partnership that we had referenced before. And as part of that partnership, the pharmacies will actually distribute it directly to those facilities and assist with them in terms of administering to their residents and staff. We received word this morning that that process has already begun in terms of transferring the doses to the pharmacies, and they have already started scheduling appointments with different facilities across the county. And the expectation is that that likely will begin late December or the first week of January. So I know that it makes for a boring news conference in terms of not being able to have tons of details to share with you as we continue to get more information as information becomes available. But I do want to let folks in Montgomery County know that we do have active plans in place that will be made public and further crystallized once we get some more details. I'll stop there, but as always, happy to answer questions at the conclusion of the presentation.
Good afternoon, everybody. Just a few updates on the vaccine front. The county website actually will feature a new vaccine Q&A page. As Dr. Gayles alluded to, there are probably more questions than there are answers at this point, but we're going to try and keep it up to date as the information continues to develop, as federal and state guidelines increase and change, and we'll continue to provide information. You can find that on our webpage, right in the news and information section. It should be right at the top of that top bar in orange highlighted. So we will be keeping that up to date. The one other piece I do want to talk a bit more about is the big box store change that we made this week and what it'll mean for next week. And so, as the county executive alluded to, there will be a process whereby letters of approval can be requested for big box stores who wish to exceed the 150 person, which is inclusive of both customers and staff, in their stores. What we will be doing is reviewing those plans when they're submitted by next Monday evening. We'll be taking, as they come in, we'll review them, but those that come in on Monday evening will get reviewed on Tuesday. The goal is to provide the businesses with feedback on that Tuesday and essentially say, based on what you've submitted and the safety measures and physical space that you have worked out, we're approving you with this many occupants. And or we may say you're approved contingent upon doing A, B, and C additional activities. And so we have seen across the county, generally speaking, that there are some retailers, large retailers, that are doing exceptionally good job in terms of counting people in stores, cleaning materials, ensuring that there's distancing, not just in a line, but between lines, all the things that we would expect to see, in safe conduct of essential services during a pandemic. There are, however, other stores who have become increasingly lax in their enforcement or implementation of some of these safety measures. And so our original intent in eliminating it to 150 was to try to prevent the widespread exposure that could happen in a setting where people are being more lax in their implementation. Obviously, with the closure of indoor dining, we will be transitioning some of our more of our enforcement activities over to focus on retailers, including our large retailers. So we're attempting to hit this challenge from both sides of requiring that they have some developed plans and giving them feedback and guidelines on how those plans, how we view those plans, how complete they are, how they can modify them to be more complete, but also that we will be doing and holding them accountable to those plans through enforcement. And so we realize that our large retailers, our small retailers as well, provide essential services, particularly groceries and other things that we cannot do without as a community. But at the same time, that those essential services cannot be the cause for people to get sick. And we do know that contact tracing data is provided shows that a number of the retail workers tend to be those. About 11% of the cases, I think, are retail workers in the state of Maryland. That's obviously troubling because those 11% of workers are also, they're being exposed by customers and they're also in turn exposing other customers. And so, that's an area where we want to try and, turn the curve further, all in an effort to get lower transmission. We're happy with what the Board of Education decided to do yesterday in setting out guidelines for how we can get students back into schools. But as I said to the County Council, I believe that some of the restrictions that we put in place are our best and frankly, perhaps our only opportunity to try and drive down transmission to the levels of that are consistent with the state guidelines for education being back in person. So this is all part of the interlinked effort to try and address some of our key challenges moving forward. So I will stop there.
Right. Thank you very much. And just as a reminder, if you have a question, please, for reporters, please make sure that you put your news organization in there as well, so we'll be able to know and who you'd like to speak with. As always, our first question comes from Chris Gordon from NBC4. He has a question for Dr. Gayles, County Executive, as well as Dr. Stoddard. Go ahead, Chris.
Thank you very much, Barry. This is a three-part question. There are some restaurants, one Tasty Diner in Bethesda and Silver Spring, that say they're closing now for the second time. Their employees are missing the gratuities of Christmas. Unemployment is running out for those that they haven't brought back. And the county isn't offering enough help, they say, in terms of grants. They say they don't need loans, they need grants. That's the one question, I guess, would be to the county executive. And the other two would have to do with some of these outdoor tents that are four-sided, or some of these enclosed spaces, plastic enclosed spaces. Even though they're outside, aren't they kind of an incubator or a petri dish for the spread of COVID? So how do you make that distinction? Are four-sided tents legal? And all of them seem to be complaining about the exception for the big boxes. I'll leave it at that.
Where I want to start, I guess I can start with the tent issue. The tent issue is one that we did clarify in the executive order. Tents are required in order to be considered outdoor space to have at least one of the four sides, if they're a rectangular or square, open to open air. If all four sides are enclosed, they are considered indoor space. We have a permitting process through our Department of Permitting Services, and this has been in place actually for quite a while now, where structural tents of a certain size, which you would find typically outside of a restaurant, in most cases are required to be permitted. And as part of that process, they're reviewing that you have one of those four sides open. If you have a yurt or circular shaped object, we generally say 25% needs to be open in order for it to be an outdoor space. We have suggested as part of the order that if people have questions about their tents or want to seek approval for their tents, they should do that through a letter of approval process. We will be continuing to monitor outdoor dining, which would include those tent spaces in terms of both our education and our enforcement. Candidly, we are aware of and have seen some of the pictures of some of the efforts to enclose spaces, and we'll be going out and investigating some of those, because frankly, the pictures that you see posted on social media reflect some significant concerns about how enclosed those spaces are. Obviously, the more structure you give a tent and the more closure you have, the more it is simply just indoor space and does not meet the same standards and protections and would not be deemed as much. I will note that the much of the law around tents and what's an indoor space and outdoor space actually goes back to some of the cigarette smoking regulations that were put into place long before COVID-19, and we are generally following those in making determinations about what indoor and outdoor space is, because essentially, you know, smoking cigarettes and secondhand smoke follows many of the same types of ventilation and spread or exposure rules that COVID might. And so obviously that is helpful that the legislation has largely existed in many settings to set that forth for tents and other structures. So that's the question.
Okay.
County executive, do we want to talk? I mean, I know, I'm sure, I mean, as sort of the county executive alluded to in the beginning, aid for restaurants and other businesses is a key component of what should be part of the federal aid package that is being much discussed, certainly today. We obviously have been tracking throughout the day the progress that they claim to be making on this, and hope by Friday that they will have something in place. From the county perspective, a lot of what we've been focused on in terms of our recovery framework has been how can we use the lessons that we learned from the CARES Act and others to inform exactly how quickly we can get dollars that are shared with the county governments out to the businesses in a much quicker fashion. And so that's been a much greater area of emphasis, but I'm sure the county executive could talk to you about, some of the challenges that, the local governments face in terms of their ability to act as a surrogate for what the federal government can do in terms of aid.
I'll just say we're going to continue to look at what we can do, and we're anxious to see what the governor sends down to the counties in order to provide additional aid. I know there's, he's talked about increasing his spending on this. We're waiting till after the first of the year, and we'll be redistributing money, we hope, in some ways to continue to supplement it. But the county could never address the magnitude of this problem. We do not have the resources to address the magnitude of this problem. You would literally pretty much have to shut the entire government down to do that, and that's not going to be very productive either. So we're heavily dependent on what the federal government does, as is every other jurisdiction, frankly, as is the state of Maryland. We need help. They've got the capacity to provide it, and they need to provide it.
Okay, our next question is from Penelope Jones of Blake Beat. She has a question for Dr. Gayles and the county executive.
Hi, yes. I have two questions, one for Dr. Gayles and one for County Executive Marc Elrich. Dr. Gayles, what are the metrics you're using to determine youth sports following COVID-safe guidelines are contributing significantly to the rise in cases?
Thank you. The metrics that we're using to assess all activities, including sports, retail, businesses, and others, have been very transparent in terms of the overall guidelines that we've put out as a county. As it relates specifically to youth sports, what we have been looking at also is the fact that we have seen a number of investigations involving cases across a scope of different sports and athletic opportunities, including hockey, soccer, basketball, football, baseball, as well as cheerleading activities. And we have seen numerous examples across those sports as recently over the past weekend. And it has been concerning given the number of cases happening and these cases continuing to happen in spite of the provisions and parameters that have been put into place to support, safe activities. Now, in addition to that, we have also heard from a number of schools that have brought up, and Dr. Stoddard has mentioned this in a number of previous press conferences, that have brought up the concern of student athletes participating in sports whether it be locally as well as traveling to other jurisdictions that may have higher rates of community transmission of COVID-19, and concerns about bringing that back into the classroom due to that sense of high risk exposure. And so with all of those things in mind, we took the step to acknowledge that this was a concerning activity that was putting young people at risk. And in spite of the fact that there were parameters and guidelines put into place, in many of those instances, that guidance was not followed. And so as a result, and again, looking across the broad scope of different activities that we could put restrictions in, again, to bring the number of cases down, that was one of the activities that we took further steps in. I would note that the steps that we took and the recommendations that we provided did leave parameters for certain activities to continue to be done, such as drills and those kinds of things, just in a limited capacity. There are other jurisdictions across the region and across the state that have actually taken further levels of restrictions where they have banned all youth sports activity in any way, shape, or form. So in summary, we use the metrics that we use broadly across the board for all activities, but what was concerning about the youth sports activity is we kept seeing again and again situations where we were having cases pop up and potential outbreaks to have to address.
You also had a question for the county executive? Or does that cover it? Okay. Next question is from Kate from WTOP. She has a question for the county executive and Dr. Gayles.
There we go. I wanted to check in with you on the, again, distribution of vaccines. And I know, Dr. Gayles, you said there's not a whole lot you can tell us at this point. And Dr. Stoddard, you said that there is something on the website now. Which particular website? And will there be, just as the state has talked about, because you have to make an appointment to get vaccines, we'll be able to tell how many and where. Can people also track that in real time?
So thanks for your question. I think the first part of it is yes. So as part of the apparatus that will, at least for the early stages of how the vaccines will be rolled out, we will be utilizing multiple electronic platforms that will allow us to track the number of folks who are receiving vaccine, as well as being able to use that information to send people reminders to come back in and get their second doses, so being able to track their process. There is an electronic platform called PrepMod, in which individuals will be able to schedule their appointments and times to be able to come in, so that yes, we do get a sense of the volume and we are able to track and have a better sense of who's come in and who still needs to come in to address those numbers. In addition to that, we expect that once we again get more of a sense of what volume we will get and what schedule that will be done on, is that we'll be able to scale out and better, for example, set up appointment times, build the capacity around getting as many people as we can in quickly, as well as looking at how we can continue to partner with our community partners, some of which are firming up right now as we speak, to be able to help us in that endeavor, provide the vaccines for first-line responders and healthcare workers who may fall, between the cracks and are not covered by the health system distribution or the long-term care facility distribution process. So again, in summary, we are working on those details, or we're hoping to get those details, and we'll roll that out. But yes, we will utilize electronic platforms to be able to track and keep track of how many people have come in and be able to provide them with their follow-up reminders.
And can I get a follow-up for County Executive on Delegate Eric Lutke came up with a piece of suggested legislation, and I'm sorry, I'm looking for it right now, but you may have heard mention of it, an attempt to, again, provide more relief for people who are most hit by the actions that have had to be taken to keep everyone safe, closings, shutdowns, etc. Are you working with members of the General Assembly on ways that at the state level people can be assisted because of, whatever may or may not happen on Capitol Hill?
We're going to be working with the Assembly throughout the session to make sure we get the most, advantageous and useful legislation that we can possibly get. They understand what we're dealing with. I mean, we're in touch with them and they're in touch with us. I have bi-weekly meetings with the legislature, so we're in conversations about what it is we can do and, what difference we can make at the state level. And I know that the comptroller has called on the governor to dip deeper into their reserves in order to provide a greater level of relief to the business community. And I'm certainly supportive of his efforts to do that.
Thank you.
All right, we're going to go to Rebecca from.
One more point.
Sure.
Kate, the link to the vaccine website is in the chat. It's montgomerycountymd.gov/COVID-19/vaccine, and that'll be a link, but it's on the news and information tab right at the top.
Perfect. Thank you.
So we're going to Rebecca from the Washington Post. She has a question for the county executive and Dr. Gayles.
My first question for Dr. Gayles, it's about vaccine distribution. I'm wondering if you can say where group home residents with intellectual and developmental disabilities are in terms of vaccine priority. We know that Virginia considers those residents as residents of long-term care settings, so they're in this top, band of priority. I'm wondering, does Montgomery categorize them in the same way as well?
So Rebecca, thank you for your question. I'd just like to reiterate my earlier statement. Again, we're awaiting that guideline, that set of guidelines from the state. Now, certainly, I bet as best as I can say is I wouldn't disagree with what Virginia's characterization in terms of how those populations are. But as it currently stands, the state is handling those distinctions. And, that I can say as having been a part of those conversations, those types of things are under consideration. And, I'm hopeful that we'll get those official guidelines, much like Virginia has put out, as you referenced, from the state in the very near future.
Got it. And for Dr. Stoddard, as well as the County Executive Elrich, I'm wondering if you can provide us a general update on Karazhak funding, which you referenced earlier, Dr. Stoddard. We know that the deadline is coming up, and as of today, I think we don't know that there's going to be an extension of that deadline, and we know that Montgomery County still has several $1 million left unspent. What is the strategy here, and what's going to happen on December 31st?
Thanks, Executive Elrich. Do you want to start, or I certainly can? Okay, I'll start. So we had a meeting on it today. I think, to be clear, the county has expended well over $183 million in responding to this event, whether that's through response activities, our pay for employees, work money that we put out through businesses, housing, food assistance, across the board. So we've vastly exceeded the 183, and largely what we're going to be doing is an accounting measure where we're trying to triangulate exactly what we're going to get FEMA reimbursement for, to take that off the list and put other things that FEMA does not accept on the list. We've talked about this before. Mm-hmm. There will be no issue with us spending down $183 million. No issue at all. As I said, there is even a period of time after December 30th where we get to move things around, so long as we spend it before December 30th. So there is some accounting that we get to do on the back end, because obviously we'll be incurring the costs all the way up to and through December 30th. And December 30th, we'll have to get those costs to be able to book them on board. So we have so far submitted approximately $64 million to FEMA and are awaiting some feedback on the second $32 million that we submitted. It was largely differential and other personnel costs. We have another tranche of, just happens to be another $32 million going forward this week. So we'll be up to approximately $96 million by the end of this week, and are working on additional submissions as well. It has been indicated to us by some of our, by some of the connections on the Hill, that there may be an extension included as part of this relief package that Congress is considering. And so we are actively waiting to see if that happens. Obviously that, we've already spent $183 million, as I said. So largely this gives us just more time to figure out what's the best 183 to put on the care as I understand it, the part of the Congress's questions that they're trying to work through today also includes whether they will allow FEMA to do 100% without doing the 25% match, which obviously would free up additional dollars for us to, from the CARES Act that we've had to put on for the FEMA match. That would free up additional dollars and open up well. So we're going to be doing some, accounting work between now and, even after December 30th, because we've already spent the money, and we just need to get the best 183 on there and the other money over to FEMA and what we need to spend in the general fund as well. Trying to triangulate all this stuff.
So, and a quick follow-up for County Executive Elrich on that, I guess. Speaking of the discussions on the Hill, we've seen news reports coming out that part of this new package does not include aid for state and local governments. Does the county have the ability to continue funding some of its relief efforts without additional federal support? Or are you worried about this new package or the fact that there's not going to be local?
I'm worried about this new package, but I'm also hoping that, once we get in with a different president, so that wild card is taken out of the occasion, out of the consideration, that they will bring forward another package. And my understanding is they plan on post-inauguration policy recommendations as well. We really need the support, and I don't, this is going to be a national problem. Everybody faced shutdowns. Everybody has too many people without work who are not going to pay the income taxes that everybody projected. Too many businesses that are out of business, that they're not generating the sales taxes, running the revenues that local governments expected to see. And none of us are in a position to say, well, it's of no consequence if they close down. It's actually a really big consequence if these businesses close down permanently. So we need the federal government to act. There's no two ways about this, and it'll be very hard for us to continue the same level of funding for anything if we do not get additional assistance from the federal government. And of course, some part of this is a discussion with what's happening with FEMA right now, how much FEMA decides to cover or not cover, which apparently is something that they don't have strict guidelines on, that it comes down to being a decision that they make somewhat arbitrarily. That is also something that could be subject to change after a new president is there. So we're continuing to, wait. And I think Dr. Stoddard framed it pretty well. We're trying to make sure that we don't use up a CARES dollar for something that could be covered by a FEMA dollar, because then that CARES dollar becomes available for more. On the other hand, if I spend CARES dollars and then try to go back with FEMA money, I think we've explained this in earlier meetings, once we've spent the CARES dollar, I can't reimburse the CARES dollar with the FEMA dollar. If I spend the county dollar, I can replace that with the FEMA dollar. So we're being very careful, and they're going to keep, looking at the numbers and seeing which things should go in which column up to the last day that we're allowed to make this submission. We want as much money in the county as we can possibly get in the county.
Okay. Next question we have is from Deidre from MMC Media.
Hi, thank you for taking my question. I have a question for Dr. Gayles. Dr. Gayles, yesterday you briefed the county council and spoke about hospital beds and the issues around them, and said that 3 out of 6 hospitals in Montgomery County had no ICU vacancies. And there was also 1 hospital with no acute care bed vacancies. I wanted to know if there was an update on those numbers, what the state or county is doing to get more hospital beds, and is there possibly a projected date that our hospitals could max out when it comes to ICU capacity or bed capacity? How's that going?
Sure. Well, Deirdre, before I answer your question, I think the first person who asked questions, Penelope, maybe had a follow-up question and maybe got locked out. So just wanted to bring that to Barry's attention. so that she'll get an opportunity to ask
Yep.
her other question.
She will.
But as it relates to the specifics with capacities, so the capacity numbers are fluid and we monitor them every day. And forgive me, I don't have today. I usually get the updated report about 2 o'clock in the afternoon, so we're 30 minutes early for that. But that information is updated on the website. And so I actually had a great conversation with a couple of the hospital leaders this morning that actually reported, at least for their facilities, that the numbers are trending in a better direction in comparison to where they were in the spring related to surge. Now, the key is we don't want everyone to say, well, it's fixed. No, there's nothing to worry about. Is we know that, again, hospital numbers typically lag behind the cases. And the models, again, that we have received from our academic partners as well as National Capital Region Surveillance does suggest that, again, that through the holidays that we could be potentially looking at elevated hospital rates as we continue to move through the end of December and into early next year. Now, the strategies that are being utilized to increase capacity are very similar to the playbooks that the hospitals within the county used back in the spring. And we'd like to commend our health systems here locally for doing a fantastic job in creating that platform and infrastructure then and being able to roll it out now. So for example, the first line of adjustments, if you will, that the hospitals will do is they will look internally within their physical blueprint of their hospitals and look at ways that they can expand capacity through potentially cohorting patients who are non-COVID related, as well as converting spaces that are typically just for acute care and increasing their ability to be able to provide additional critical care space or ICU space. Now, the physical piece has been probably the least bit of the headache. It's been more of the ability to bring on adequate staff to be able to staff those extra beds if they're turned over. And so far, things seem to be doing well across, all of the different health system fronts. Now, one of the other things that I'd like to highlight is it's really a collaborative effort of the hospitals. If you recall back in the spring, there's the Tacoma Park campus of the Adventist Health System that was built out and has been able to be used for rollover space for non-COVID patients. I think that was the initial opportunity to take the less severe patients and put them there to free up the tertiary care space for COVID patients. But from my understanding, they've actually been able to bring in and absorb patients from all of the different hospitals, including some of their hospital partners who aren't technically a part of their system. So it's, again, evidence of our health systems working together to be able to come up with creative strategies to address the potential surge space. As it currently stands, I have every bit of confidence that they will be able to absorb at least up to a certain level, because there are also some other strategies in addition to increasing the space and increasing the staff is other strategies such as, for example, decreasing or stopping elective procedures again to free up that space there. So the playbook is in place. It's actively being used. And, as we continue to monitor the numbers and monitor the trends, we'll certainly have to keep an eye out on that. And we will certainly keep the public up to date on those numbers as we move forward.
I would only add too, because of some of the provisions that the state has put in, it's not likely you're going to see the counties in a particular county maxed out, whereas the rest of the state has plenty of bed capacity. They're going to be moving patients around throughout the system, so it's going to raise the water level essentially on all the boats nearly evenly or close to evenly. Now, what happens as you get closer to the, we don't have a lot of capacity in the overall system, and I think the governor already talked about earlier this week being at the highest level statewide, is that, even if we've got capacity in Montgomery County, they're going to start bringing in patients from other areas of the state into our beds and starting to fill those. And so it's not likely you're going to see Montgomery County run out of beds, for example, and Howard General has a ton of beds available. They'll be moving patients throughout the process. So when we get to when you start to hear about some of the Western Maryland hospitals filling up, that naturally is going to begin to mean that we're going to run into more problems in Montgomery County as well. So I think that's the thing that we have to be very cognizant of, and it is a system of healthcare, not just within the state, but within our region and beyond. And we're trying to moderate it at that level. But it does mean that we'll be, once you start to fill out in a county, there's not going to be a ton of other places to go, because presumably those other counties around you will be filling up just as quickly. So.
Thank you.
And we're gonna loop back to Penelope, who had a question, but she got cut off. So Penelope, could you go with your question?
Hi, yes, thank you for circling back to me. My question was, County Executive Marc Elrich, will you be receiving the vaccine publicly when the time comes for you to be vaccinated, regardless of which vaccine is administered to you?
I will be receiving I'll be receiving it, and then I'll get my vaccine when it's my turn to get my vaccine.
Regardless of
So-
which vaccine is administered to you?
Pretty much.
All right, thank you so much.
Okay.
All right, and we'll go to Brianna from Bethesda B. You have a question, I believe, for Dr. Gayles.
Yes, thank you. I was just wondering if you could clarify. I know you mentioned that the county doesn't yet know how many doses of the vaccine will be coming here. Does that include that we don't know how many vaccines will be going to hospitals today and tomorrow? And also a second question, is it possible for the county to arrange with any of the hospitals for the media to be able to observe and document the first person in Montgomery County to receive a vaccine?
Well, the second component of that, thank you for your question. I think the second component, you would have to, work directly with the hospitals on that in terms of the distribution. From my understanding, that at least I've only received qualitative updates from the institutions to say that they have vaccines on the way, and I think at least 2 of them, they physically have had at least one of the shipments come in. I think what you're looking at is probably the doses being calculated based upon the size of the health systems. And so you're probably looking at potentially larger facilities getting somewhere on average around, maybe 1,800 to 2,000 doses as part of the first wave. And from my understanding, again, they're being shipped directly to the hospitals, is that they're likely to receive a similar supply on a weekly basis. And so just to give you a scope of that, so let's say hospital X gets 1,800 a week and they have 14,000 staff members across their system that have to be vaccinated. So just to level set in terms of expectations, as the doses currently stand, you're looking at probably a 4 to 6 week timeline for the entirety of those systems to get coverage. And then, again, this is one of the larger systems. The hope is that as time moves forward and as production increases, those weekly deliveries will increase in quantity and we'll be able to get a larger number of folks through the queues in a quicker amount of time.
Great, thank you.
And we have a question, we have a follow-up question from Kate Ryan.
Thank you. Sadly, I'm aware, due to a loss of someone that we know due to COVID, the funeral homes have told family members that they are backed up. What are you hearing from funeral homes? What are the implications and concerns for future public health on that as well?
I think what we can say is that yes, that is happening, due to the volume. And to use the county executive's words earlier, it's a sobering reminder of where we are. I think many instances we receive a lot of feedback, whether it's through email or social media, asking us why are we stoking the flames of panic and why are we blowing things out of proportion? But the reality is when you look at a situation where funeral homes are backed up and they are extremely busy due to the volume of patients coming in, that speaks to what, we still have significant concerns in terms of COVID-related fatalities as well as, COVID-related hospitalizations. So we continue to, work with them to make sure that they have appropriate personal protective equipment and those kinds of things as they continue to move forward and execute the practices that they have to put into place.
I would just add, and this is something that we've known about for a long time before COVID, but the decedent care processes in our society are not built for huge changes, in the number of people who pass away. And having spoken with someone actually yesterday who recently lost a family member and was going through this process, they described exactly what you've described, Kate, with there being a delay in getting that person into a funeral home, getting them out of the hospital, getting them into a funeral home. And so I think we got a little bit of questioning from certain people about why we were providing the hospitals with refrigerated trucks already. It isn't that bad yet. And the point, I think, is that there is not a ton of capacity in that side of the system on a day-to-day basis. And so obviously we do not want situations where, what happens is the funeral homes back up and then they back up into the hospitals. The hospitals don't have a ton of capacity either to store or manage decedents. And, typically most hospitals may have 8 to 10 refrigerated morgue slots. And that, unfortunately across 6 hospitals, that's 50 people a day essentially. And that's not a huge number. And that's why we, have been concerned about that portion of this for some time now.
Okay. That is our last question.
Actually, Barry, could I make one comment?
Sure.
I just wanted to circle back to a question asked earlier in terms of getting the vaccine. So our hope is that when we get it available, as we said, we'll continue to follow through the priority groups and how that's defined. And I believe I may be considered to be a healthcare worker in that process. And so I look forward to receiving the vaccine, whichever dose it is, whichever type it is, and we'll do my best and we'll do our best to make sure that we're very transparent about that process and transparent about what the experience looks like in terms of getting it, as well as what happens after we get it, with the first dose and the second dose. So hopefully we will be able to answer any questions that folks have and be able to allay any concerns that they have to make them feel more comfortable.
Okay, that is our last question. Going once, twice, and as always, 3 times. Thank you, everybody. Be safe out there. I do want to say one quick thing before we go. With our businesses not allowing indoor service, I encourage all the media to share with your readers and viewers the MoCo Marketplace, as well as visit Montgomery for MoCo Eats. That way residents can support those businesses, even though they can't sit inside. So thank you very much. And next week, we'll be doing our briefing on Tuesday instead of Wednesday. So look out for that notice coming early next week. Take care and have a safe day.